Now, Gauteng accounts for a large majority of the recent COVID-19 infections as the third wave takes hold in South Africa. Public and private hospitals are facing an increased demand for beds and oxygen concentrators. Meanwhile, the Military Health Service Unit is being roped in to assist at struggling provincial hospitals, and that's as authorities are also considering harsher restrictions to curb the spread of the virus, specifically here in Gauteng, where the Provincial Coronavirus Command Council is set to meet today. Now, Gift to the Givers has outlined what it will take to get Gauteng through the third wave. Imtiaz Sooliman is the founder of that organization, and he joins us now live. Imtiaz, it's great to have you with us on the show this morning. Thanks for joining us. And you've written quite a disturbing report in the Daily Maverick on where Gauteng is now in its fight against the third wave. And it's all about shortages. Shortage of medical professionals, of oxygen concentrators, of hospital beds. And the thing is, we haven't, it appears, learned much from the first or second wave.
Yes, good morning, Michelle. It's much of the very, very same thing, you know, in most aspects. But there are certain variations in the third wave compared to the first and the second wave. From the outset, if we remember, the lockdown was announced, you know, on the 27th of March last year to give the country time to prepare the hospitals. That, in effect, was not done. And I said that quite loudly and clearly because one of the key factors in dealing with COVID-19 is to have adequate healthcare professionals. And that doesn't mean doctors only. It means doctors, nurses, porters, everybody that run a hospital system. Because from experience we've seen in Europe and America, who are, you know, ahead of us in terms of the infections and the experience from there, that the doctors and the healthcare workers get burnt out. We had many posts that were not filled in most of the hospitals in South Africa and are still not filled in South Africa. You know, and yet there's many doctors walking around without any jobs.
Yeah.
So the first major failure was not to put in healthcare workers. Secondly, you know, with the first wave we managed with, in terms of beds to some extent, we managed with oxygen. But the second wave showed us that with that strain, that the second strain that we had, the oxygen requirements were huge. And we didn't have enough oxygen points or enough oxygen, bulk oxygen, or enough oxygen delivering machines, you know, at the second wave. But at that point, we started saying that the vaccination is the key. Yes, vaccination may be the key, but depending how fast you do it, how fast you get herd immunity, what strain you're fighting against, how fast the healthcare workers and the rest of the population gets vaccinated. And the focus was only on the vaccines. And, you know, if we didn't meet that demand, which we haven't met it right now, what happens? We failed to do what we're supposed to do from the beginning. Put healthcare professionals, put oxygen points, put, you know, more oxygen. We didn't do that. And now Gauteng is paying the price for that failure to do what's supposed to be done during the second wave in preparation for the third wave. And the difference is now that whilst Gauteng didn't do so bad in the second wave, that is a relative statement, is we have an additional problem. We have one of the major hospitals that dealt with COVID-19 in Gauteng shut. Charlotte Makeke Hospital, at its peak, was holding 300 critically ill COVID-19 patients. Now it means you are 300 beds short for the cases, and people are floundering, don't know what to do. And that's why there's such a huge demand for oxygen concentrators. Why? Because people are now staying at home. And it's not ideal because the oxygen requirement may be far more than 5 liters or 10 liters, you know, but patients have nothing else, they got nowhere else to go. The private hospitals are full, the public hospitals are full. They wait anxiously, driving from hospital to hospital, waiting outside casualty, and then you go into casualty, the guy says, send the patients, but there's no guarantee we'll find you a bed.
Sure.
And when they're inside, after 8 or 9 hours, they said, go home. So now what the general practitioners and physicians are saying, you know what, rather let's just treat the patients at home. Whatever happens, happens.
Sure.
If you're lucky, you get a bed for the patient and you send him to hospital. But in most cases, we are going to be unlucky, and that's why you see the number of deaths rising every day.
I mean, this is devastating what you're describing, Imtiaz, and it's the reality for so many people around the country. Particularly, we're focusing on Gauteng today, given the surge in infection in this province in particular. But what it signals, and as you say, what it shows is just the lack of preparedness from government, despite all of the warnings. We just need to look at other countries to see what we could have done so much better.
It's a dismal failure, to put it bluntly. And you start dithering about how to open Charlotte Makeke. you have to follow this rule and that legal entity and follow something else. Yes, the hospital got burnt, we understand that. But did the whole hospital burn? Part of it burnt. So can't we shut off the part of the hospital and still open? They got fantastic. I mean, I was there 2 weeks ago. I got a shock to see what a beautiful hospital this is. You know, in your mind, because I haven't been in practice, I haven't been in hospitals for a long time. In your mind, you think it's a government hospital, it can't be so grand. But this is an absolutely fantastic hospital. It's got 28 theaters. Not that we need theaters now for COVID-19, but it's got fantastic ICUs for pediatric, for medical, for surgical, and for COVID. All that is being wasted whilst patients are floundering, not knowing where to go. We need somebody in the government who's got a decision-making process, who can take a decision. There's a serious lack of leadership. How can you allow patients to be struggling when nobody can get together and say, look, we need to take a decision. Yes, the rule says you're going to have this form and that paper and that certificate. But this is an emergency. You know what? You can bypass all those things by declaring rules that can bypass, at the same time, making sure that nobody's lives will be put at risk. And that can be done by cutting out part of the hospital. Even if 2/3 are functional or half is functional, it takes a huge burden of other hospitals.
Yeah, and it's about saving lives. Imtiaz, tell us about the kinds of calls Gift of the Givers has been getting from family of people suffering from COVID-19, desperate for oxygen canisters.
It's nothing new. We got that in the first wave, far more in the second wave. But what has been frightening in the third wave is that doctors are calling for oxygen, not patients to that extent. When doctors are saying, like in the last 48 hours, well, let's put it this way, on Sunday, we got so many calls for oxygen concentrators. So we asked, but you guys had oxygen concentrators in the first and the second wave. Where are they now? The one guy said, we've already used 140. And we're way behind what we require. And this is a doctor. And he says, we probably need another 500 to 1,000. That's from one area of Joburg. I get a call from other areas of Gauteng to say, we use 100. They're not coming back. People are still sick. We need another, we need another 40 or 50 more immediately. And the similar calls comes from other parts of Gauteng to say, you know, we are in serious trouble. So then doctors call. They say, we are physicians. Can we put up the patients in a hall? So I said, why are you going to do that? They said, there's no hospital beds. So I said, are you going to take responsibility of this patient after 4 o'clock in the afternoon? Are you going to be there the whole night? And if there's not one, 10 or 15, are you going to look after all those patients? The physician says, no, I can't do that. So I said then, safer to leave them at home with their families. And we can't bring families to the hall because that would become a super spreader event. Unfortunately, South Africans are not disciplined. So you know what? You're going to have a problem where the super spreader events in the hall. So I said, what's the requirement? They said, look, we need oxygen in hospitals, but there's no hospital to go to. There's no beds. The casualties are full. All we can do as physicians and GPs is go to people's homes. Now that's a huge strain on healthcare personnel to go to people's homes. It takes up a hell of a lot of time, and especially when there's so many patients and there's so many ill people, you can't be having that kind of situation. You need to free the healthcare workers and to put more staff and to expand more hospitals. There is another solution, obviously, by the way, and this is, if we can open Charlotte Makeke partially. Look, now what I'm telling you, I've been to the hospital, I don't know the engineering plan, but it looks quite clear that you can use quite a bit of that hospital. I'm not an engineer, but from what it seems, it's fine for part of the hospital. Then I've been told by staff who are working in Hillbrow Hospital that the hospital is only 40% capacity. What stops us from doing cosmetic renovations, making it look nice if it needs renovations, put in oxygen points if they don't have it, and open up more facilities in Hillbrow? You're taking the pressure off other hospitals. Then the shocking news is, I've been told, facilities were built in Maraguana, but they're not open. They're not being used, dedicated for COVID-19. I haven't seen those facilities, but I got information from more than one source.
Yeah.
And the other point is, somebody sent me a video of a hospital that was built in 96 in Kempton Park. It was never used apparently. It's vandalized, it's there for the taking. Enough space, all it requires again is renovation. For COVID, you need oxygen points, beds, and staff. That's all you require, nothing more than that.
Yeah.
And you know, and if there's ICU required, open up Charlotte Makeke. We've got the ICU facilities there, and you can move patients from these other places to Charlotte Makeke.
I mean, you know, it's difficult to understand from what you're describing that government hasn't described the situation in the same kind of panicked way that you just have, Imtiaz. Is there real political will to make the changes, to open the hospitals, to hire the staff, to do what's needed?
I can't say there's no political will. Look, at a time, whilst I'm saying government's not doing the right thing, at the same time, there's a lot of good people in government who want the right thing to be done. The problem is their own rules. They are caught up in their own regulations. They don't know how to bypass their own systems. Their systems are bogging them down, and they true to the letter of the law. This is an emergency. Emergency means all the rules are broken. You know, you do what is necessary to save life. But of course, by taking due precaution, making sure the structure is not going to fall on 50 patients in child Mekeka's case, or whatever needs to be done. Bring in more medical staff, hire people, call them from the public, we'll pay you for 3 months, 6 months, whatever. You know what, we need to bring personnel in. And the other great asset in COVID-19 are paramedics.
Yeah.
We put paramedics, 19 of them in Livingston Hospital, and they're working like machines. All you need is someone to monitor the oxygen and to see what's going on, and then report to a physician. So these things can be done, you know. So I'm not saying there's a lack of political will. Maybe there's anxiety, maybe there's fear, maybe people are scared that if something goes wrong, I'll take the fall. No, I'll just look at the irresponsible one. But you need leadership.
Yeah.
The government seriously needs to show leadership, because not them, the citizens are suffering and they're dying.
Yeah, absolutely. Lives are at stake. We need medical professionals. We need oxygen concentrators. We need COVID-19 beds. Imtiaz Sooliman is the founder of Gift of the Givers. Thanks, as always, for your time here on the AM Report.